Hi, I'm Dr. Monroe. Ms. Lentz asked me to make a video, fairly short video about being a pediatrician, about the um, education, about the kind of the process and how to get here, and then just a little bit about what it's like being a doctor and the highs and lows and the joys. So thanks for listening. I guess the whole process starts in college. You go to college um, for usually 4 years. It took me longer. I changed my major several times, but there are prerequisites that you have to get to go to medical school. So usually that's different biology, chemistries, anatomy, physiology, different sort of subjects like that, math, physics, other things. Typically, most people will end up getting biology degrees or chemistry degrees in college, although plenty of people get other sorts of degrees. I had classmates in medical school who had English degrees, history. One of my classmates had a math degree, but also, had those prerequisites um, to be eligible to apply for medical school. So that's what college is like. A lot of people try to do other things in college, get experience with, in different clinics or different medical experiences, laboratories, things like that. I wasn't able to do any of those things myself, but plenty of people do, and I think those are worthwhile things to do in college just to prepare you for this life and to see what it's like before you actually jump on board. Um, Unfortunately, I wasn't able to have those opportunities, although I did have lots of other opportunities. I worked in a vet clinic for one, and some other interesting things. But that's what you aim to do in college. You've got to get your prerequisites. You've got to have a high GPA, and it's nice if you have some sort of experience. But the major thing that you're getting ready for in college is the medical college admissions test called the MCAT. And I'm going to talk about a few big tests that you have to take in this process, and the MCAT is the first one of those. And it's a big test. It covers lots of science, of course, and different things, but just a big test that you have to take. So your MCAT score often determines if you can go to medical school. It can also determine scholarships and other things like that. Much like the ACT and the SAT that you take to get into college, the MCAT is one of those kind of standardized tests. And so when you're in college, you're trying to get good GPA, you're trying to get experience, all of those things. But in reality, you're getting ready to take the MCAT. And so you take your MCAT, and hopefully you get a good score, one that allows you to apply to medical school and get in. So that's the first big hurdle that you have to jump through. And then you go off to medical school. And so that's its own different world. Medical school, it's 4 years, and it's divided sort of in half, where the first 2 years, different schools do it different ways. And my experiences in medical school is almost 25 years ago. So some things have changed and some haven't. But in general, the first 2 years are what I would call bench science, non-clinical science. And so it's more of what you might have taken in college, just at a different level, a different intensity. It's gross anatomy, it's biochemistry, histology, pathology, physiology, neuroanatomy, genetics, biostatistics, classes like that are more just science-oriented classes. I'll tell you a little bit about gross anatomy, which is what people always want to hear about. And where I went to medical school, that was the first big class. And so you took it from August to December, that very first semester of medical school. And it was sort of jump in and get it done. And so it's a huge room full of cadavers, and we usually had either 3 or 4 students on a cadaver. So 3 or 4 students in my little group would dissect the entire human body over the course of those months. It was very intense, very weird, upsetting in ways. It's just kind of your first taste of this world that you're getting into. Um, Unfortunately, one of my partners on my cadaver didn't make it through the first week. He quit, and so that was how intense it was. And the test, just thinking about those memories, the test, we'd have sort of a practical test of gross anatomy. And you would walk in with your clipboard, with your sheet of paper with 100 or 150, I don't know how many, blanks on it. And you would face this room full of cadavers, and each cadaver had one or two or three, you know, um, 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 parts or pieces of the anatomy tagged. And so you'd have a piece of an anatomy with a string around it or a pin in it and a little number. And so you'd have to go through and just write what that was. And so not multiple choice or anything, you just had to come up with it. And that was that was quite an experience. Um, and so and so in the first 2 years, you're doing more of that. You're with a microscope, looking at histology, looking at pathology, looking at slides. It's heavy science. The second 2 years, or the third and fourth year of medical school, is your clinical training. And so, again, some schools do this a little bit differently now, but in general, it's the first 2 years of science, second two as clinical. And so between that first two and second 2 years, you have your next big, huge test, which is the U.S. Medical Licensing Examination. USMLE is what it's called. And it's in 3 steps. And so you take the first step after your first 2 years of medical school. And so it's all basic science. It's all heavy science. And so hopefully you get over that hurdle and go on to third year. Third year and fourth year is, again, where it's all clinic. You're in the hospital all the time. You might, I mean, my experience was I would be there for days at a time. Sometimes you'd sleep in a call room. You would work, pretty much constantly, and getting loads and loads and loads of clinical experience. For instance, my first day of my third year of medical school, my first rotation was OBGYN. And so it was 6 weeks of OBGYN. You take it in different blocks. And on my very first day, the very first baby I saw delivered on my OB rotation, I delivered it myself. I was there delivering the baby. The resident was in the room floating around somewhere, and another student or two, but the first birth I witnessed, I delivered myself. And so that gives you a little taste of what third year and fourth year medical school is like. You're thrown right in there and you just do it. I did my medical school at University of Mississippi. We were at a big public hospital, the only one in the state, large urban hospital. And so we got to see lots of different things and have lots of those kind of experiences where you just jump in and you have to do it. I thought of another time where, I'd seen people suture. People, they teach you, the residents, other students teach you how to suture. But then, eventually you're suturing on your own. And that was kind of a third year medical student job in the emergency room. And so I'll never forget sewing up this guy's head. It was an older man and he'd been in a car accident, and so, I was up above his head, so he couldn't really see me, see how much I was sweating through this experience. And he said, "Oh, I'm sure you've done this many times before." And I said, "Well, I've not." I didn't tell him he was the first live patient I'd ever sutured. But again, experiences like that, they're just really forming and extremely, extremely meaningful. And so, you do that your third and fourth year. And sometime in your third year, hopefully you can decide what specialty you'd like to go into, what your special interest is. And then your fourth year, you have a lot more flexibility that year to set things up as far as what rotations you want to take, what special interest you might have. Mine was pediatrics, others, surgery or whatever else. And so, there's some things you have to take, but some other rotations that you can sort of craft yourself. And so that was the fourth year of medical school. The other big test, again, this is a life of big tests, and so you take your step 2 of your USMLE, the medical licensing exam, sometime in that first, between third or fourth year, sometime in there. And so another huge test, it's clinical, it's on all types of clinical knowledge. And so that's another big standardized test to take. And then in fourth year, again, hopefully you've identified an interest and have an aptitude for something, and then so the next step that you do after medical school is residency. And so depending on what specialty you choose, you might a minimum of 3 years up to 5 or 7 or more years for different surgical specialties. And so when you're a resident, you're a physician, so you have an MD. You don't have a full license yet, but you practice under what's called a provisional license or an intern license. And so then you go off to residency. So I did a pediatrics residency, which was just more intense clinical training. And so your 3 years of residency, you're getting more and more and more knowledge. You're teaching more and more. And so, the interns might teach the third-year medical students. The second and third year residents might teach the interns, which is your first year of residency. And so that's how the layers of teaching go. And so again, it's kind of trial by fire stuff. It's you jump right in there and you're working in insane number of hours, but getting lots and lots of clinical experience and training. Mostly hospital-based. Most residencies are like that. We had some outpatient-based clinic in my particular residency, but most of it was, in the hospital in the ICUs. I didn't do a surgical residency, so I didn't have any surgery type training. But if you did surgery, of course, you'd be in the ORs a lot, and so again, you sort of you're just getting formed and getting and honing your craft the whole time, getting different experiences, making mistakes. Having your upper level residents or even your attending physicians, the ones that are sort of in charge, really point out your errors and point out what you could have done differently, and so those are difficult times, difficult things to learn. But that's part of the whole process. And so, so now you're a resident, so you're in residency. At some point in residency, after the intern year or the first year of residency, you take that last step of your medical licensing exam, the step 3 of the USMLE. And so that's, again, huge step, because after you pass that, you've passed your step 1, your step 2, your step 3, then you're eligible for a license. And so you can get a full license to practice medicine based on what state that you're in and what you're planning on doing. The vast, vast majority of people, of course, will finish residency, but some don't. Some will do an intern year, especially if you're in the military, if you do certain things. You might not complete an entire residency. You might do enough to get your license and then go practice. But that's what that is like. At the end of residency, so you're whatever number of years that it is, you've got your training. Now you're eligible for your boards, which is the last and biggest, honestly, biggest test, biggest standardized test that you'll take. And some people, it's a written test, or these days computers. Some people have oral boards where you sit in a room with 2 or 3 physicians and they ask you questions. And some have a mix, but you sit for those boards, and that's the biggest test, because then that means you are board certified. So I'm a board certified pediatrician. So, which is a major thing for just for the world that we live in, for hospital privileges, for malpractice insurance, all sorts of different things. You really need your board certification in whatever field that you're going into. And so that's the last sort of big hurdle, and then you jump off into practice. And so that was a whole nother life in and of itself. But there are many different avenues that you can practice. These days, and a big change that's happened in the past 20 years is is a bifurcation between hospital-based physicians and often hospital-employed physicians. So you're either in the hospital or you're in the outpatient world. So you've got this difference between, are you going to do hospital medicine or are you going to do outpatient medicine? And that's a huge, huge change, and a change that just came to our practice here locally just last year. And so until I believe it was last year. Until last year, we, the 5 pediatricians here in Boone at Blue Ridge Pediatrics, we were practicing in the hospital and doing our practice, our private practice that we have. But we're not even doing that anymore. So that's a nationwide trend. There are many different reasons for that, but essentially, when you get done with these days, and who knows what it'll be like in 20 more years or 10 more years or whatever. But these days, you pretty much go off into the hospital or you go off into the outpatient world. Both of which there are pluses and minuses of both of those things, but that's kind of the way the world is with medicine right now. A few things about medicine itself. I'll tell you, it's a great gift. It is a gift to be able to sit and with a patient or with a family, and a patient and family like we do in pediatrics, and work through different issues, see them and walk through them with this journey of parenting, of illness, of death sometimes. And thankfully, we don't deal with death in pediatrics very much, but it definitely happens, and it's happened to me and my patients. And I've had to, you just walk through that. But that's a great, great gift to be able to offer someone and to offer your career and really your life. And medicine, for many and for me in particular, is truly a calling that it's not a job that you just sort of go off and do, and you clock in, you clock out, and you come home. It's your job. Medicine for most, and I think in its best form for all, is not like that. Medicine is a calling where you're truly called to be in service to others, and that's a very special thing, and something that requires a lot. It requires a lot of training to have the skill to diagnose things, to treat things, but certainly there's also just the skill in sitting and holding someone's hand as they're going through something. And that's I would call it a gift to be able to help people like that, but also a true calling, not something that you step into easily, not something that you would get into for the thrill, certainly, or for sure for the money. I think those, if you were thinking about this occupation, I would ask you to guard against that, because I think you'll end up being pretty disappointed. But if you go into it for the interest, just the scientific interest of, in my world, what does this child have? They can't tell me what they have. They can't tell me oftentimes what hurts. Have to figure that out, especially with babies, with infants. So there's that curiosity that I think you need to have. There is a certain amount of, again, scientific sort of inquiry that you have to look at, say, how can I solve this problem? And then there is just the service aspect where you're helping someone. And I'll tell you, one of the greatest gifts that we have in pediatrics is the long-term relationship that we have with patients. I'm thinking of a child I saw just last week that when he was born in the nursery here at the hospital, he was extremely sick. I had to go there, resuscitate him, intubate him, give him medicines, put a tube down his throat, put him on a ventilator. He was a super sick infant. Made it through all of that, and just the other day I did his kindergarten checkup, just in that short 5 years, the relationship that you establish is full of meaning and full of just kind of amazement that I'm able to have this gift to sit with folks like this, with parents. And so that's kind of what medicine is like for me. That's what pediatrics is like. So thanks for listening. Thanks for your interest. Thanks for Miss Lentz for asking me to do this. Bye-bye.